Tongue is a movable muscular organ situated in the oral cavity. General features. It has an apex, a base. So it has an apex, a base. The base is attached to the mandible and the hyoid bone. Two surfaces, dorsal surface and the ventral surface, and two lateral borders. Dorsal surface, it is divided into anterior 2/3 and posterior 1/3 by a inverted V-shaped groove known as sulcus terminalis. Sulcus terminalis. The anterior 2/3 of the dorsal surface is rough and contains taste buds, valid papillae, pungiform papillae, and filiform papillae. Three types of taste buds. The posterior 1/3 of the tongue contains group of lymphatic tissue covered by mucous membrane known as lingual tonsil. Lingual tonsil. Ventral surface. It has a median fold of mucous membrane. Attaches the tongue to the floor of the oral cavity. That is known as frenulum linguae. Lateral to the frenulum linguae, there are two comb-like structured mucous membrane attached to the lateral aspect of the tongue on the inferior surface. That is known as plica fimbriata. Between the frenulum linguae and plica fimbriata, there intervenes a vein known as deep lingual vein or profunda lingual vein. Profunda means deep. Blood supply. Lingual artery. Venous drainage. Lingual vein. Deep lingual vein. Muscles of the tongue. What are the muscles of the tongue? The tongue consists of both extrinsic muscles and intrinsic muscles. Extrinsic means coming from outside and attached to the tongue. Intrinsic means the muscles present within the tongue. The intrinsic muscles present inside the tongue or within the tongue are altering the shape of the tongue. Altering the shape of the tongue. The extrinsic muscles are movement of the tongue, or altering the position of the tongue. So these are the intrinsic and extrinsic muscles. Nerve supply. The tongue has sensory, special sensory, and motor nerve supply. Sensory, general, special sensory, taste, motor, that means supplies the muscles. Sensory. For the anterior 2/3 of the tongue, the sensory is bilingual nerve. It is a branch of trigeminal nerve, the fifth cranial nerve. Posterior 1/3 of the tongue, the sensory is by glossopharyngeal nerve, the ninth cranial nerve. Special sensory taste. The anterior 2/3 of the tongue, special sensory is by chorda tympani, branch of facial nerve, the seventh cranial nerve. Special sensory for the posterior 1/3 of the tongue by the glossopharyngeal nerve. So, for sensory and special sensory in the anterior 2/3, there are two nerves, whereas in case of posterior 1/3 of the tongue, sensory and special sensory is by single nerve. So, sensory, lingual nerve, special sensory, chorda tympani. Sensory, posterior 1/3 sensory, glossopharyngeal nerve, as well as special sensory, glossopharyngeal nerve. Motor, that means supplying the muscles of the tongue. All the muscles of the tongue are supplied by hypoglossal nerve, the 12th cranial nerve, except palatoglossus, which is supplied by accessory nerve, that is the 11th cranial nerve.